Open.
Oh,
Okay,
through the
we
night.
have 0 viewers. Can,
Good.
can you see how many? Can you see how many people are watching?
No, I can't. I guess that's all up
You
to you.
have nothing on your thing. Oh, you're doing it on the phone, aren't you?
Yeah, so I don't know if I'll even see any comments if they come up,
Okay.
but I guess we'll see.
Okay. Are you able to see
Because
the chat?
I don't know.
Can you see the chat? There. I just sent something. Uh, No,
Nothing is
you
coming
can't
up.
see it. Okay. Oh, we have 3 viewers. Hey, welcome to Auburn Medical Group. Here, let me make myself big so they can see me. Welcome to Auburn Medical Group live YouTube with Dr. Gawayne. Dr. Gawayne, why don't you say nice things to all the people?
Nice things to all the people.
There you go. Okay, we now have 21
Oh,
viewers.
nice.
Yeah, 28. So those of you
Ah,
watching, please do use the chat function to tell us where you're from. And of course, if anybody wants to use super chat, you're always welcome to use that, which I don't even know if it works on this. But so
good
let's see
question.
who our people are. As soon as you guys start writing it, I need to put myself big so I can talk to them. As soon as you guys start writing in where you're from, we'll start announcing it. And Dr. Gawayne will know that way because I have to read it to him
Yeah,
unless he can
unfortunately,
see the
can't see it.
chats. You can't see
I
the chats.
I
You
cannot.
can't see the
No.
chats
So-
from these 28 people who are watching. Okay,
No.
so still looking for the chats. Don't see any just yet. I'm looking over at the group chat and not seeing anybody saying where they're from. Hey, please let us know where you're from, and we'll
I'm
go
from
ahead.
Auburn, California.
Dr. Gawayne, yes, you are from Auburn, California. Thank you for sharing that. I'll go ahead and
uh,
take over again and encourage people to go ahead and send in their chats. And usually when this happens, people are trying to send in chats, and for some reason I'm not able to see it. So let's see if I can pull it up by hitting something else. So what I'll do is I'll hand the camera over onto you while
okay.
I see if I can pull up the chats on something else. So tell us a little bit about what you think about participating in live YouTube.
All right. So, yeah, I guess usually I'm on the chat side doing this and not doing the video thing. So this part is new for me. I'm not in front of the camera. Well, I guess yeah, in front of the camera as much as Dr. Mark Vaughan is, but you'll see me on occasion on the Auburn Medical Group YouTube channel. Um, yeah, what do we want to talk about? Do you have anything specific? This was mostly just a trial, but if anybody wants to talk about anything, we definitely could do that. It's later here in Auburn. It's about 10:30, so we just figured we'd try to get something going. Um,
Okay, I can take over for a moment here.
I can't see
I'm
any of the
trying to
chats. I don't
find.
know if anything's coming up.
I'm not seeing any chat either.
Oh, bummer.
I would be
These
excited to see some.
these
I'm sure
28
there's
people
some
are
out there,
probably
and we're
really, really
these.
bored with
Well,
us
now it's
just talking.
24. It's
we're,
now
lo-
24,
we're
but
losing viewers.
I am convinced that they are out there trying to reach us. Let me minimize the screen here, minimize this screen, and see if I have another way of finding where their
You know
chats are
what?
ending up. What's
I
that? Go ahead.
I may have a way of doing that. Let me log on and see if I could do it on my other
Okay, you
computer.
do that. Okay, you do that. While you do that, I'll go ahead and talk to all the nice people. Now, we don't
You
know
do
where you're
that.
from right. Yes, I'll do that. We don't know where all you nice from people are from right now, but as soon as Dr. Gawayne gets set up, we fully expect that he'll be able to read your chat messages so that we can
Hopefully.
respond to
Let's
them
see here.
on
Oh,
this
dang.
super late or dual presenter
Oh,
YouTube live
we have.
stream.
Oh, I'm gonna have to mute this. So, hey, we've got
Okay, so
so many. It's ridiculous, actually. Let's see.
yeah.
Petra Rosenberg was the first one. She
Oh,
says hi.
Petra. Hi, Petra.
Yep.
Okay, you go ahead. You go ahead and read
Norma
through some
Jean
of them.
Green says hi, Dr. Zahn. Dr. Lorraine Butler in the UK. All right. Brenda Lee, Eli, Nevada. Eastern Colorado, Linda Tanowski. You probably know some of these names. Sorry,
I
I'm
believe it's pronounced
looking.
Ely, Nevada.
Oh, Ely. Oh, you're probably right. Vicky Kostelnik, Dunbar, and now you just put me on. It just looks like me looking off the screen and all these. Oh, we got BooBoo Kitty here. Rumor has it that the stork brought me. Jeremy Lee Bonner, hello from Dallas. Philip Taylor. Uh-oh, moving too fastly. Joy Marie Franklin, hi, Washington State. Petra Rosenberg, nice to see you, Gawayne. Nice to see you too. Oh, wait, I gotta look at this. I'm using two computers here. This is a little
Nice to
weird.
see you.
1:30 a.m. over on the East Coast. BooBoo Kitty staying up for us. 1:30 a.m. in Virginia. Jen Ligon, hi from Australia. Ms. T, Squirrel, Iowa. Missy Klein, Kansas. Hey, yeah, we're all over the place. Okay, I think I'm caught up now. So there it is. This is a little awkward where I'm reading it on my computer where my phone is up here though. If there was any way, I gotta kind of put it next to it. And there's a delay, so it's kind of weird watching myself.
Okay, thank you so much. You did an excellent job of reading. What we'll do is switch back to you to get another update on the chat stream that's coming through. It's good to know that we do have Petra Rosenberg and BooBoo Kitty out there. I recognize those names. Not as familiar with some of the other ones. And I've been trying to find, this is the first time we've done a dual presenter live stream on YouTube. This is a first for the YouTube channel, or for the Auburn Medical Group YouTube channel. And I'm still trying to find how to see these chats where I am so that we can respond to them. I will still respond to you guys. We'll have Dr. Gawayne read them. Dr. Gawayne, are there any more right now?
Yep, Petra Rosenberg says it's 7:30 in Sweden, a.m.
7:30
a.m. Let's see, Joy Marie Franklin, is it streaming? She's not getting anything, unfortunately. I can see it on the computer, so I'm sorry about that, Joy Marie. Hi, yeah, from Northern California. Wait, Debbie Ronker? Are you in Northern California as well? I don't know. Oh, let's see here. Oh, lost it. Fingers getting a little too crazy.
Okay.
Yeah,
one thing I'd like to know.
I lost it.
I just took over. I still don't have the chat on my computer, but Dr. Gawayne does. One thing I'd like to know is how is the audio and how is the switching back and forth for the video? Are you guys able to follow what's going on and see the person who's talking and hear and understand the person who's talking? If you can answer that question and put it in the chat, please let us know, and Dr. Gawayne will read it. Dr. Gawayne, do you have anything, any updates on the chat for us?
BooBoo Kitty asked if you saw the ear clean video Dr. Gilmore posted today. I have not.
I did not see the ear cleaning video Dr. Gilmore posted. Sorry, I haven't caught that one.
Jen Ligon, I hope I'm saying that right, says she's from Sacramento, so she's actually pretty close. So it's 10:30 for her.
Oh, wow.
Too. So I guess it's working and doing well. Somebody says it's just a little delayed, so that's kind of the tough part. And I can actually see that too, that it's a little delayed too.
Okay, not the first time we've had somebody that's a little delayed on the show, but we'll work with it.
Hey, I'm here. It's me. I'm delayed. No. And then let's see. Other people say audio's fine. The back and forth is fine. Audio's great. Switch is working perfect. Petra says both audio video is good for me. So we're good in Sweden apparently. BooBoo Kitty says audio is good. Camera switch is smooth. So awesome. It sounds like it's working quite well. The switch is just one person at a time, so it doesn't have like an inlay. I can tell you that because I'm seeing it here. So there's no inlay, so it's just one person or the other. There's not both of us at the same time. So I don't know if there's a way to see both of us at the same time. Let's see here. I can hear and see you, Debbie Ronker.
I do not know of a way to have it show both of us at the same time. I can see both of us at the same time, but
yeah, me too, but that's not helpful. Let's see. Miss T, I can see chat and see and hear you guys. A little buffering now and then, but not bad. Audrey Bunch says hi. So,
Audrey
yeah, I guess I'm
Bunch?
just do you know that name?
I think Audrey Bunch is one of our more recent but very regular commenters. Is that you, Audrey? I think I maybe once was a little snarky in one of my responses to her, but she's very forgiving, and I think somebody explained that I have a dry sense of humor to her in the comments. If that's you, Audrey, let me know. I think that's Audrey Bunch. Is that you?
We'll see, but a few updates since then. BooBoo Kitty says you're very colorful, and I'm apparently not. Just by our videos, it's your really bright
Yes,
yellow shirt. I
it's
think.
It's a matter of lighting and the camera and yeah, things like that.
She says I blend into the background. It's my gray. Yeah, yeah. It does. Do I? If I stand up, do? Oh, look at that! I do blend into the background. I can disappear.
It's a floating dismembered head.
It's like that video of the snake. Have you seen that one? The new that new whatever the video you can't see. Anybody else? Anyone? The new not video. The picture of the copperhead snake that's blending in. All right. Not cool enough for you guys, I guess.
I've seen a copperhead in the wild in southern Illinois.
Oh, let's see. Petra Rosenberg, did you see that I changed my account in Patreon, or does it only show on the day when it draws on my bank account?
I should probably take over here and tell Petra, we have seen two things about your activity on Patreon. One was incredible, and then you followed it up with something just absolutely surprising, and thank you so much. You now get your name mentioned in videos. In fact, the next video to come out will have your name mentioned on it on Friday, and I follow you on social media. That's part of it too, and your name is in the written description of all the videos now. So, and even of this, your name is in the written description of the description that goes with this video. So thank you, Petra. Thank you. We have noticed.
Let's see. Jonah says, hey guys, do you know Jonah?
Hi, Jonah.
Squirrel, I can hear great and see you both. BooBoo Kitty says copperheads are pretty but scary. They're pretty scary.
I agree. That's fair, yes. So I'd like to ask, let me take over here. Sometimes it will automatically switch to me when I start talking. It senses wherever the audio signal is. Yeah, it's kind of cool. I would like to know if people would like to see like a regular Ask the Doctors show with Dr. Mark and Dr. Gawayne on YouTube Live like this. If you guys would like something along those lines, please comment. And I know I've asked you for times before in the past, and I didn't really give them to you. I apologize for that. But let us know, and Dr. Gawayne will read them. We'll discuss this. We will talk about it.
So let's see here. Where are we at? Somebody wants to talk about multiple sclerosis, but I think we'll discuss the other stuff. We'll definitely have to talk about the multiple sclerosis, Debbie Ronker, but right now I guess we want to try to figure out this whole thing. Billy Goat, I'm listening to you guys till I fall asleep because I'm tired from work. Oh, awesome. That's what did you guys have for dinner? He just wants to have a conversation, Billy Goat 126. My first time here. What kind of doctors are you both? We can talk a little bit about ourselves, I guess, but let me catch up here. Bunnies are evil. Thanks, BooBoo Kitty. I don't, but were you talking about bunnies? Let's see. Norma Jean.
Bunnies are evil? Yes. I didn't.
I'm not too good at following these. You're really good at like remembering different conversations as you go through. Like it's done in and out. So you try to follow these as I
you give them to me and I'll try to follow.
Tammy Warren says yes, absolutely yes. So I think all these people are saying yes, that we probably should do one of these dual Ask the Doctors or whatever we want to call it. Petra Rosenberg, thanks. Great that it worked. I was a bit worried because it hasn't drawn on my account yet. Saw on Patreon yesterday that it will be drawn on May 1st. Okay. Thank you, Petra. We do appreciate that. Jonah, yeah, that would be awesome. So apparently the general consensus is that this would be a good thing, the back and forth. And it sounds like the back and forth is doing well. So one person asked what kind of doctors we are. Most people know that. I'm a good doctor, personally. I think Dr. Mark Vaughn's an even better doctor, though.
A great doctor. That's what kind of doctors we are. Now, some of these people could be totally brand new to the YouTube channel and come across it, who knows how, and not know us. So I'll give it just a brief little introduction to myself while you get caught up on comments and fill us in. We're both family practice physicians in Auburn, California, in the Auburn Medical Group. We're the only physicians in the group, but we do also have Jennifer Cochran, a mid-level physician assistant, but she's on maternity leave right now. And we have a couple of other physician assistants who are going to be filling in over the next 3 months until she gets back on her, well, not back on her feet, but comes back to work. I have an emergency medicine background before family medicine, whereas Dr. Gawayne actually did family medicine residency before he started practicing. So he's a little bit more right on with his training for what we're doing currently. With my emergency medicine background, it allows us to have a little bit of insight into the emergency aspect of things that we take care of. It's kind of fun. Dr. Gawayne, do you have anything updated?
Yeah. Let's see here. Where are we at?
Oh, let me interrupt just to let you know our viewers, our number of viewers is going up rather than down, which means having two of us is better than just one as far as viewers sticking around. We have 32 or 31 right now.
Hey, excellent. That sounds good. I can actually see that. But let's see. They apparently I'm pretty blurry to the people, and I can actually see that I'm pretty blurry too. And people don't like that I blend into the background.
You just blend into the background. It's your life story.
I'm gonna go change into my really bright yellow shirt right now. Apparently,
I'm sure that
my lighting's good. Maybe it's because I'm in my living room and you're in your kitchen. Kitchens are a little, I don't know.
I do have a very bright kitchen. I have the can lights above me. I have an incandescent light here, and then on the table over there. So, except it's coming more straight down than straight on. If I face this way, maybe it's a little bit better, but I can't really put the computer up there because then, yeah. All right, we'll go back to you.
It's a reflection. It's hurting my eyes. No, just kidding. Hey, we've got a nice question from Missy Klein, who says, what's the difference between a PCP and an internist? The answer is PCP is a drug and an internist is a doctor.
Okay, yes, PCP is phencyclidine. It causes rotary nystagmus of the eyes. And let's see, what else about PCP? Yeah. I believe it's a stimulant, but it may also be a hallucinogen. Do you know?
You get hallucinations.
You remember both of those?
So Petra Rosenberg apparently just saw our operation video last week from the high school where I removed that cyst from your neck. Yeah, I hope you enjoyed that. That was a fun time. Yep, you still got the scar, but actually you can barely see that scar. Look at that. That doctor must have done a good job. Sorry, Missy Klein. I do know that you meant primary care physician. So primary care physician is a PCP or PMD, primary medical doctor. And an internist can be a primary medical doctor, but so can a family medical or a family physician, which is what I am. So a PCP is just a general term for whoever your primary care physician is, whoever primarily takes care of you. And that can be an internist, or if you're a child, it can be a pediatrician, or it can be a family doctor if you're anywhere along those lines.
I believe that sometimes obstetricians, gynecologists will take on the role of primary care provider specifically for women, but that's kind of a small segment.
One person, Tammy Warren, says that she has interstitial cystitis, degenerative disc disease, lower back, I would imagine. And she suddenly had bladder incontinence only at night. And she's had 2 back surgeries. What could be the cause of that? I'll hand that over to you.
Oh my goodness. So urinary incontinence at night. Of course, you have to be thinking of something involving the spine just because of the history. But usually, when there's a problem going on with the cord, like a central cord syndrome or a cauda equina, it's inability to urinate and fecal incontinence. And so this not fitting that pattern, I think it's probably not going to be solved by us over the internet. I think it's probably going to involve either a urologist or a urogynecologist, like our friend Dr. Dunn, or a neurologist. Dr. Gawayne, do you have any other directions you would take this?
It sounds like you need to see your PCP and have them evaluate so they can direct you towards the appropriate doctor. So yeah, yeah, it does not fit with a cauda equina syndrome, as it's called, which is a lower back nerve impingement syndrome that's severe and in an emergency. But you definitely need to see your doctor for sure.
Okay, so obviously we're not going to solve it. This would be a good time for me to give the disclaimer. We do not practice medicine over the internet. We are not licensed to do that, nor would we take that upon ourselves. We answer general questions. Hey, Dr. Vaughan, if a person had incontinence at night after they had a history of such and such, what would you be thinking? You know, word your question. It's like Jeopardy where you have to word the answer in the form of a question. Word your question in the form of a general, let's talk about a medical topic question, which is actually more fun, I feel, when we're doing this kind of YouTube stream thing than what we do all day long. Comes across to an audience, but a community that enjoys talking about medical topics.
All right, I can try to catch up on some of these. A bunch of people are writing stuff. Let's see, what type of doctor should I see for neuropathy? Probably a neurologist. Let's see, can either of you talk about Sjogren's syndrome? I don't know if you want to do that. There's a bunch more. How do you decide whether to see a family practice doc or an internist? Oh, that may be a fun question to answer. I have shrinking lung syndrome, cyclic vomiting syndrome, SLE, APS, lots of stuff going on there. Family physicians are trained. They're kind of the jack of all trades, master of none, if you want to think of it that way. Internists get a little more training on the adult diseases, and that's kind of a springboard for a lot of the medical specialties, such as cardiology, pulmonology, and some of the other ones. So when you have a lot of issues, some family physicians are a little uncomfortable treating those, but I still see just about anybody. There are a few people I turn away based on their medical condition, but yeah, that's the difference. Some physical or some family physicians, sorry, are a little more timid when it comes to things. The nice thing is family physicians do a lot more procedures, so you can get a lot more from a family physician, in my opinion. Internists are more cerebral, and they're figuring things out up here. So I don't know how your opinion
I'd say
on that.
that's accurate. Yeah, I think that's pretty good. I'm sorry, I'm bouncing back and forth with the picture here. One of the things I wanted to be very sure of is that we're not missing any super chats. But since I can't see where you turn it on or off here, I don't know if it's functioning. So Dr. Gawayne, if you see any super chats, please be sure to catch those. And if anybody would like to, even just, well, I know it means somebody's spending money to do it. So, but if anybody wants to, please send a super chat just so we can see if it works, or let us know if you have the little dollar sign there, because I don't even know if that's available when we do the dual person setup. So
I can see it there. So it is
there.
there.
Oh, okay. Never mind.
Honestly. Yeah.
You guys don't have to do it unless you want to. It'll allow you to get a lot of attention. I'll tell you that.
Let's see here. Petra Rosenberg had a recent operation and it's going better. She had bad sepsis. Now I'm only been draining 2 times a week. since this week. I don't know if you know more about that. I think you were following her.
She had a horrible, horrible situation after her hysterectomy. She had a wound infection. She had the cellulitis creeping up her abdomen. She had to go back to the hospital. Um, yeah, I follow her on social media, and yeah, we've seen these horrible things happen, and it's very good to hear that she's finally doing a little better with less drainage out of it.
Let's see here. Claire Millet says, I watch you all the time. She's purchased a Bionics because of you and explained it to Dr. Gilmore today after his procedure. Cool. Hey, you are making Bionics money. You need to call them and let them know that. So they can send you more stuff. Anyways,
Bionics
back
needs
to
to answer my call.
oh, let's see. T. Livingston's leaving us. Good night. Yeah, it's 2 a.m. where T. Livingston is. Let's see here. BooBoo Kitty thinks it's funny that we're only doctors during the day. That's why I blend into the background during the evening. Let's see. Carol Ratliff. I'm only 25. I really have come to not being able to do much anymore. Oh, I think she was stating some of that. She was the one who had MS and MCTD, lupus and scleroderma. Oh, I am so sorry. That is those autoimmune diseases are just miserable, and I am sorry you're going through that. At 25, nonetheless. Goodness. Let's see. I see my family doctor for nephrology. Yes, we do nephrology. We do everything actually, except some major surgeries. Jen Legan says she has asthma and went on desensitization treatment. Worked for a few years. Had to go back on beclomethasone. Do we develop new allergies? Oh, do you want to answer that? Do we develop new allergies as we get older?
I'd love to take on that one. Allergies. You are not born with allergies, for one thing. Allergies are something that occur when you have antibodies to something and you get a hyper response to it. It's something that in an environment that's not normally damaging to the human body, like a bacteria or a virus, but your body responds to it as if it is. And you get this response with release of chemicals like histamine and mast cells releasing other what we call vasoactive peptides. You get swelling, you get sneezing, you can get wheezing, you can get shortness of breath, you can get low blood pressure from blood vessels relaxing in the response to these chemicals that are released. And you have to somehow develop the antibodies to it. Well, you can't develop an antibody to something you have not been exposed to. So that's why generally when a person moves from one area of the country to another that has very different allergens around them, generally they have to live there for 3 to 4 years before they start being allergic to their local area. I can go into great depth about treating and who we refer on to allergists, but I want to first see what Dr. Gawayne's schedule is like, because we were just doing this as a bit of a test just to see if it could be done and if there's people out there. So let me just check with him on our schedule here.
My whole family's asleep. So the problem is I do have a 5-month-old baby about 2 rooms that way. That is probably gonna wake up in a few hours and need me. So my wife and I take turns, so I probably should get some sleep.
Okay. So let's bring this one to a close. It was a fun test, you guys. Thank you so much for participating. Dr. Gawayne, thank you so much for participating. I'll go ahead and let you say goodbye, and then I'll just close us out.
Sure. I won't do your cool catchphrase because I don't have a cool catchphrase like that, but maybe I need to come up with one. Maybe we should have people comment about that. But yes, it
make
was
one
fun.
up for
They probably will. Yeah. Stay in good health. Wait, no, that's yours. I can't steal that one. But
I'll come up with something else.
Yeah, let me know. It was fun. It was good to see. Well, not see, but read all your comments. And thanks for participating. I'll send it back to you.
And thank you. Thank you, Dr. Gawayne. Good night, and good night to your family. Thank you, everybody, for participating and being so kind to Dr. Gawayne and letting him read your comments. I can't read your comments anymore because he's off now. But we will do this again, and keep commenting on the videos, the regular videos. Be sure to watch Friday's video at 4 o'clock. You can also follow on Twitter at Dr. Vaughan. You can follow Snapchat at Dr. Vaughan. You can follow Auburn Medical Group on Facebook. Be sure you're following on YouTube. And for those of you who want to go another step and get more stuff that anybody else does, you can get on Patreon. Just look up Auburn Medical Group on patreon.com. In fact, it's just patreon.com/Auburn Medical Group. We'll do this again. Thank you again so much. Until next time, both Drs. Vaughan telling all of you to stay in good health.